At Dayton Interventional Radiology, our practice is focused and has an expertise in treating vein disorders that is unparalleled in the greater tri-state area. The two main areas that we're looking at are patients who have DVT and patients who have bad veins, because the valves in their veins are so bad that they're just letting all this blood pool back into their legs, and the result is long-term pain, leg pain and swelling disorders. Now, both of these problems can be treated with interventional radiology procedures. Traditionally, there's been some emphasis on varicose veins, but varicose veins are just a small little cosmetic disorder that patients are getting treatment for. But there's a huge underlying problem with veins, and there's venous disease that affects so many millions of Americans every year. What happens is, as blood's leaving your leg, so much of the blood just pulls back down and trickles back down, either because the patient has a blood clot or a DVT, or they have valves that are bad in their veins and they're not letting the blood leave the leg. And so what needs to happen is we need to figure out a way to reroute the blood into the deeper, healthier veins so that blood gets out of your leg and there's less pressure on the little tiny nerves underneath the skin, because that's what's causing the feeling of the tiredness and the fatigueness and the cramps and the restless leg. The nice thing is that there's a treatment option for this. Just like in the old days we used to strip veins, we don't do that anymore. There's a more advanced technology that we're using with laser ablation, where we go in with a little laser fiber, making one little puncture using an ultrasound as your guidance, and we close down the bad veins after we identify what's going on with these veins. Once we close down the bad veins, we reroute the blood into the deeper veins where the valves are stronger. It's kind of like using it, if I use an analogy when I talk to my patients, I tell them it's like taking traffic on a highway and focusing on getting traffic out in one direction and closing off all the other exits. Because if cars are coming off of the exit, then the cars are not staying on the highway and we're not getting traffic out of town, so to speak. So if we can close down the exits, we're going to get more cars leaving town on the interstate, and it's the same concept. So if we can close down the bad veins that are taking blood backwards, then we're going to get more blood getting out of your leg, and your legs are going to start to feel better. The other side of this is blood clots. Now, this is in the deeper vein. This is the main highway. It's like having a roadblock in the middle of your highway with this large clot. A lot of patients know about DVTs because you hear about it in the news. It can be fatal. If one of these blood clots were to go to your lung, patient could die all of a sudden. So we do a great job as a medical society in preventing these blood clots from going to the lung. We put patients on blood thinners, but these blood thinners are not really blood dissolvers. They're not clot dissolvers. And what happens with these patients, about 20 or 30% of the patients who have a blood clot or a DVT in their leg will get hardening of that clot. And what happens is they'll get long-standing leg pain and swelling issues. And some of these patients, they'll start to get ulcers. They have a huge disability from these from this disorder, and they're usually told, well, there's not a whole lot you can do. You can do a lot of leg elevations. You can wear compression stockings. But the reality of the situation is that as an interventional radiologist, we have an expertise in reopening these blood vessels. We've had patients who've had a blood clot 20 years out, and we've been able to reopen their closed blood vessel. What we do is make a little puncture, like starting a little IV in the abnormal vein, and then we have different tools at our disposal where we can take out the clot or reopen something that's been closed for a long time. And the most amazing thing is that when you reopen even a small channel that's been closed for so long, symptomatically the patient gets relief. It's like opening up a closed dam and just creating a small little stream. Eventually enough blood will get out to where they'll get a symptomatic improvement in the way that the leg feels. These vein problems account for more than 50% of patients who have leg pain problems. So one out of every 2 patients who walks through our office door with a leg problem, I could tell you without even looking at them that they have some kind of a vein problem. That's how underdiagnosed vein disorders are in this country.